Good day everyone and welcome back to my channel today. I am Dr. Kedar and I am a consultant pediatrician and infectious disease specialist in Ankura Hospital. I also see allergy and applied immunology also. Today we will be discussing about a very interesting and important topic about antibiotics. Is antibiotics a friend or a foe? Is the question that many of us are having these days. Now, why the antibiotics have been used? What are the indications and how long should they be used? And there are a lot of other myths and FAQs that are associated with the use of antibiotics, and today we will deal with them systematically. Today the main discussion is on antibiotics. Is it a friend or a foe? I'll be dividing my topic today into 5 broad headings. First thing is, why do we need antibiotics in the first place? Second, why should antibiotics be taken? How long should the antibiotics be taken? And how to prevent the misuse of antibiotics? And lastly, what are the myths associated with antibiotics? The first topic for today is, why do we need antibiotics in the first place? As we all know, antibiotics is a cure for most dangerous infections. These infections, when left untreated, have a lot of complications. Now, I'll just broadly classify the infections into 2 types. Either they could be viral infections or bacterial infections. As we all know, viral infections, they usually don't need any antibiotic. They're all self-subsiding and they usually leave no complications at the end, but some of them do have some complications. The other group of infections are the bacterial infections. Just to make the things easy for understanding, I'm just dividing the infections into viral infections and bacterial infections. Now, coming to these bacterial infections do need the use of an antibiotic to kill the bacteria. Some of the infections for which we are already immune, we don't see any problem with that. But for some other infections, if we strongly suspect bacterial infections, antibiotic usage is essential so that this infection is completely eradicated. Many a time in the Indian scenario, we come across mixed infections where initially it starts off as a viral infection and then slowly has a bacterial component to it. So it's both bacterial and viral infection, which is called as a mixed infection or mixed sepsis. In this also antibiotic usage is required. Sometimes in viral infections, what actually happens is it alters the immune system of the body, and this alteration of the immune system of the body has a second attack of bacterial infection to the body. So this causes a lot of problems. A viral infection with a superimposed bacterial infection is the problem here, and this also definitely needs an antibiotic used. Now, how do we classify the bacterial infections? Bacterial infections are usually classified based upon the organs that they usually attack. So, for example, bacterial infections involving the brain are called as meningitis, involving the lung is called as pneumonia, involving the kidney is called as pyelonephritis, so on and so forth. So bacterial infections can be classified based upon the organ systems they attack to. Even these organs can also be attacked by a variety of viral infections also. Now, another classification of bacteria is based upon its microbiological properties, like the gram-positive or gram-negative, aerobic or anaerobic, which the details of which I don't want to go into in this today's talk, because it is beyond the scope of this talk for today. So broadly, please remember that the bacterial infection can affect any organ of the body, and bacteria are classified based upon their microbiological properties. So these two are the backbone in deciding what antibiotic to be used. Initially, antibiotic can be started based upon the organ system the bacterial infection has attacked, or based upon the nature of the microorganism if we know the microorganism. There is another thing which is called, nowadays we are reading a lot about multi-drug resistant bacteria and extremely drug resistant bacteria. What are they? Suppose I will give a small example. An example is the bacteria X should respond to A, B, C antibiotics. Now, if we say that A and B are not working against the bacteria X, so it is called as a multi-drug resistant bacteria. If more than 50% of the drugs which are suitable for killing a particular bacteria are not able to kill the bacteria, it is called as a multi-drug resistant bacteria. Now, let us consider another scenario where the same bacteria X is not responding to A, B, C and D antibiotics which are usually used to kill the bacteria. In this situation, this is called as extremely drug resistant. When a particular bacteria is not being able to be killed by more than 90% of the antibiotics that are usually used, then this is called as extremely drug resistant bacteria. So please remember that bacterial infections are not so common, and this leads to evolution of the bacteria when wrong antibiotic or misuse of antibiotic is taken, and this leads to a development of multi-drug resistant and extremely drug resistant bacteria. Now, when should antibiotic be used? Many of us have got a doubt in our mind. When should the antibiotic be used? Antibiotics, as we all know, should be used only in bacterial infection, and when we strongly suspect a viral infection, we usually differ from giving an antibiotic because all the viral infections predominantly are self-subsiding unless and until they have a life-threatening complications. So, secondly, a doctor's prescription is mandatory to start an antibiotic. Without a doctor's prescription, please don't go ahead to start an antibiotic by yourself, because this will lead to dangerous problems as drug-resistant bacteria might emerge, and misuse of antibiotics can cause long-term effects on the body, as well as next time if a person encounters a similar infection, that particular antibiotic might not work and we might have to move on a higher group of antibiotic. Sometimes we come across some patients who are admitted with us with the complaints of, for example, fever, cold, cough, loose motion, vomiting, and after admission for the next 48 to 72 hours, if there is no clinical improvement, or let's say there is a clinical deterioration, or if the investigations are pointing out to a different sort of an infection, then a probable suspected mixed infection is seen, and then an antibiotic is usually started in worsening clinical picture or not improving with supportive medications. Sometimes whenever we come across a common infection and prescribe supportive care, and if the patient is not improving for the next 24 to 48 hours, we usually go for some investigations. So what are the common investigations that we done? As you all know, the common investigations that are usually done are a complete blood picture, CRP levels, which is the marker of infection in the body, and sometimes procalcitonin, which is also a marker of infection in the body. These numbers will give us some indicators whether this could be a bacterial infection or a viral infection. For example, a rise in the WBC count, or let us say a rise in the CRP, or a rise in procalcitonin may definitely indicate a bacterial infection, and this necessitates a use of an antibiotic. The next part of our discussion is how long should an antibiotic be taken. So this usually depends upon the intensity and severity of infection. Usually antibiotics are given for a broadly 5 to 7 days based upon the organ it involves and based upon the severity of infection that is there in the body. Just like I described earlier, it depends upon the investigations that we do and all the other clinical parameters that we usually assess. We usually prescribe an antibiotic for 5 to 7 days. And it usually depends upon the severity of infection. Please mind you, it depends upon the severity of infection and the organ system which involves. For example, if there is an infection of the brain which is called as bacterial meningitis, we usually give an antibiotic for 14 days. If there is an infection of the bone which is called as osteomyelitis, we give the antibiotic for 28 days as per standard medical protocol. So the duration of the antibiotic therapy solely depends upon the organ it involves as well as the intensity and severity of the infection that we usually encounter. So please don't take matters into your hand by stopping the antibiotic whenever a doctor has prescribed an antibiotic. What is the best indication over here? When to start an antibiotic and when to stop an antibiotic? Usually there is a test that is called as a blood culture that is done, but blood culture in India, as I have seen, the yield is very low, because by the time a patient comes to us, they have already been using a course or a two of antibiotics, and once we draw the blood for the investigation, sometimes the blood culture might not yield anything. So blood culture is the gold standard investigation as per standard international guidelines to depict and treat the bacterial infection. But since we have no yield or minimal yield in the blood cultures, so what we usually do is there are certain criteria that we consider to stop the antibiotic. The first thing is investigation returning to normal. Like earlier I have said, the WBC count, the platelet count, the CRP levels and the procalcitonin levels returning back to normal, as well as there is a fever-free period of more than 2 to 3 days. That could be an indicator when to stop an antibiotic appropriately. This is the most important thing, that we see how long to give antibiotic and when to stop the antibiotic. Not only that, when to start and when to stop should be meticulously planned for every patient, and this is where the clinical acumen comes into play. How to prevent the misuse of antibiotics? Here I would say 3 I's. The I stands for the capital letter I, not the I of the I. So inadequate dosing, improper dosing and incorrect antibiotic. So I would say 3 I's should be taken into consideration to prevent the misuse of antibiotic. First thing is inadequate dosing, improper dosing and improper antibiotic choice. So I'll come to the first part, inadequate duration or inadequate dose. So what is inadequate duration? Inadequate duration means we suspect a pneumonia and give an antibiotic for 10 days, or we suspect typhoid and we give antibiotic for 14 days. Once the patient begins to feel well after 5 to 6 days, you stop the antibiotic, and this is completely irrational. Stopping the antibiotic has a very bad detrimental effect both on the body as well as the bacteria. For the body, let us say, some of the bacteria have the tendency to remain in the body for a long time, and once you stop the antibiotic, there could be a resurgence in the infection. So reoccurrences, relapses of the infection can be seen, and this leads to dangerous repercussions, because now, coming from the bacterial point of view, you have used an inadequate dose of antibiotic, and this leads to bacterial memory. Even the bacteria are living organisms and they also contain an intrinsic fighting mechanism. They do remember the antibiotic, and next time if you give the same antibiotic, they don't respond. So choosing the right duration is very, very important, apart from the right dose. Now, duration should be strictly adhered to. There is no problem if you don't start an antibiotic, but if you start an antibiotic, please adhere to the dose and duration that is mentioned by the doctor to you. This is very essential to complete the course. Now, what is its significance from the science point of view, medical point of view? So once we start an antibiotic, usually there are two phases of bacterial elimination from the body. In the first phase, the antibiotic stops the reproduction of the bacteria, thereby keeping the number of the bacteria in the body constant, or thereby reducing the number of bacteria. And the next phase, they systematically kill the bacteria. So once we start an antibiotic, in the first phase, bacterial multiplication stops. In the second phase, bacterial killing starts. So once you give the antibiotic for 3-4 days, the bacterial multiplication stops and there is a relief of symptoms. It does not mean that the bacteria are completely eliminated from the body. Stopping the antibiotic at this point of time, still the body has bacteria, and then they can grow back. And the second problem is, you are giving an inadequate dose. The bacteria remembers the antibiotic and it does not respond if you give the same antibiotic the next time, and you have to step up on the antibiotics. So this is where the problem comes in. You are creating a monster inside you. You are creating a dangerous multi-drug resistant bacteria inside you by giving an inadequate dose. So please see that the complete dose of antibiotic is given. Now, this is about duration. What about the dose? Let us say, for example, an X drug should be given at 100 mg per kg per day for 14 days, and you are giving only 50 mg per kg per day for only 5 days. Is it not an inadequate dose? So giving an inadequate dose, again, you are priming the bacterial memory, you are priming the bacterial immunity to remember this antibiotic, and the next time it doesn't respond to the antibiotic and we have to step up on the antibiotic. This creates a multi-drug resistant and an extremely drug resistant type of bacteria. Bacteria are smart, all the bacteria, all the viruses are smart. They evolve during time. They evolve with time. They can evolve into a very dangerous species. They can evolve into a monster which will not respond to any of the antibiotics, and this is what we call as superbugs. Superbugs usually don't respond to any of the antibiotics. That is just because of irrational use of antibiotic. This is the basis and the gold standard for a clinical judgment which is called as antibiotic stewardship. Antibiotic stewardship programs are there in every hospital, which are monitored by the in-house infectious disease specialist as well as microbiologist to keep in track of all the infections that we usually encounter. What is the proper antibiotic for each problem? How should we do it? And what is the minimum duration of antibiotic that should be given? And what are the side effects? What is the alternative plan B if a particular antibiotic is not responding? Or what are the information techniques where we gather, research and development techniques where we gather for the evolving bacteria and viruses. This thereby helps not only to us but also for other doctors around us for a good publication as well as imparting the knowledge to others. Now, I'll come to the third scenario. Improper antibiotic. Many a time we come across a child with cough, cold, fever for 2 days or 3 days giving an X antibiotic. This X antibiotic is usually good for urinary tract infection. So a drug which is good for urinary tract infection should never be given for respiratory infection. So choosing the right antibiotic is very important, and many a time we see lot of doctors also prescribing wrong antibiotics. This is simply beyond the scope of my imagination being an infectious disease specialist. So please see that the right antibiotic is given for the right organ system that is involved. Inadequate antibiotic, inadequate duration and inadequate dosing should be completely taken care of to prevent antibiotic resistance, development of antibiotic resistance and development of multi-drug resistant strains of bacteria. Now, there are some myths associated with antibiotic usage. The first and foremost is reduced immunity. So many parents or many patients and their attendants do ask me, sir, antibiotic usage will lead to less immunity. No, it is wrong. It doesn't affect the immunity at all. If you take inadequate dosing, inadequate duration, and inadequate drug in the wrong time, that causes loss of immunity. That causes decreased immunity. Basically, people misjudge the development of a drug-resistant bacteria into loss of immunity, which is entirely incorrect. You are developing a multi-drug resistant strain of bacteria. The bacteria is becoming resistant to the antibiotic because of the 3 I's that I have described earlier, and this is what should be taken care of. This is what should be thought of all the time. Now, many a time, many of the patients do ask me, sir, what is antibiotic resistance? So just like how I have explained, antibiotic resistance is developed by the bacteria. Basically, antibiotic resistance means that a particular bacteria is not responding to a particular antibiotic, which otherwise should have killed the bacteria. This is what is called as development of antibiotic resistance. Antibiotic resistance is usually seen in those bacteria where inadequate antibiotic is used, inadequate dosing is used, and inadequate duration is used. Sometimes there are certain acquired infections where already the patient gets an infection with a superbug, and this becomes really a problem for us to treat. Now, last topic is how to prevent these infections. See, there are 4 corners to prevent the infections. The 4 pillars of prevention of infection is the number 1 is hand hygiene, number 2 is food safety, number 3 is proper nutritional intake, and number 4 is immunization or vaccination. I'll just describe in brief about all the 4 aspects. The first thing is hand hygiene. As we all know, during COVID times, hand hygiene has got a very big importance in prevention of all the infections, not only bacterial but also viral. Hand hygiene is considered as one of the most important techniques to prevention of the spread of infection. Second thing is food safety. Many a time I came across a lot of people consuming outside food, consuming junk food, consuming unhealthy food, and all sorts of things which I don't want to go into detail because that will hurt the sentiments of many people out there. So please see that a proper healthy hygienic food is taken, and that will have a lot of benefits on the health aspect and the immunity aspect. Third thing is proper nutrition. So taking a balanced diet, not more in carbohydrates, not more in fats, good protein, good healthy protein is very important for us to develop a strong immune system which can fight the infections. And lastly, immunization, vaccination. Vaccination is the biggest cornerstone of prevention of infections. As you all know, there is a talk about vaccinations which is done by me earlier. You can refer to my links below. You can go through some of the talks that I have given for vaccination. Vaccinations are very important to prevent many of the infections, dangerous infections, and the vaccination also prevents the complications arising out of the infection. Again, I would like to just remind you once again, vaccination does not prevent the primary infection. It only prevents the complications coming out of this infection. Thanks a lot for my patient for your patient listening. And this talk has been, this idea of this talk has come to me because we are celebrating World Antibiotic Day or World Antibiotic Week from 18th to 24th November. This is to enhance the knowledge for the common people regarding antibiotic, its proper use and duration. So on the event of World Antibiotic Week, which is from 18th to 24th November, I thought of sharing some basic information about antibiotics and their usage. See, I know that complete discussion on antibiotic is not possible within 20 minutes, but as far as possible, I have tried to cover much of the important topics. So if anything else, please feel free to contact me in my website, www.drkedar.org. So you can contact me on my website and mail me for further clarifications. I would be really glad to help you out. Thank you and Jai Hind.